Hey everybody, my name is Caleb Williams, and the topic I chose to present was Lyme disease. And what is Lyme disease? The bacteria that causes Lyme disease is called Borrelia burgdorferi. The name Lyme disease originated from where the disease was first identified, which is Lyme, Connecticut. This happened in the 1970s. The story was that there were two mothers that pushed for identification of this unknown condition that was causing people to have joint pain, headaches, and numbness. The causative bacteria was later identified by Dr. Willy Burgdorfer in 1982 when he found the link between the deer tick and the condition. The deer tick was known to be carrying the bacteria, which was transferred to humans. I have a picture of the deer tick. The basics about this: the structure of the bacterium is a spirochete, and its main goal is to survive in the host, not destruction of the host cells. Spirochetes have flagella at both ends, which are long thread-like structures. These are unique in that they spiral around the cell instead of protruding straight out. You can see how they spiral around in a corkscrew fashion, which makes them twist like that. Makes it easier for it to enter the cell. These spiral-like flagella cause the bacterium to move in a corkscrew-type fashion, which allows it to invade the cell. There are three things that affect the high virulence of this bacterium: the changing surface antigens, the corkscrew movement, and the binding of the H factor that inhibits the host immune system. It kind of lets it hide from the immune system of the host. The Borrelia burgdorferi does not release toxins. Interference with normal pathophysiology, and pathophysiology is defined as the disordered physiological processes associated with disease or injury. In 70 to 80% of the cases, a classic erythema migrans rash appears at the tick bite. This rash resembles a bullseye. And the picture I have it's not very clear, but it's a picture of the rash on someone's shoulder, and it looks exactly like a bullseye. And that's the first sign that somebody has Lyme disease. It usually appears from 3 to 30 days after the tick bite. The typical symptoms include fever, headache, fatigue, and skin rash. And if left untreated, it can spread to joints, the heart, and the nervous system, although it could possibly affect any organ in the body. What's interesting is that this disease is not present nationwide. It is concentrated in the Northeast and Upper Midwest. The highest number of cases reported from 2001 to 2015 was in boys ages 5 to 9. This is a picture showing the difference between 2001 and 2015, how it kind of exploded in the Northeast and Upper Midwest. There is a higher incidence in males up until the age of 65, when it begins to even out and even reverse in later years, with women being higher. In one study in Maryland, over a 4-year period from 1992 to 1996, the incident rate was 6.3 times higher in whites versus African Americans. Digging into the actual symptoms of this, whites had a higher rate of the rash, the bullseye rash that I showed earlier, whereas African Americans had a higher rate of arthritis. Over a 15-year period, the number of confirmed cases has nearly quadrupled from approximately 10,000 cases to nearly 40,000 cases. This substantial increase in confirmed cases is having a significant impact on these regions, primarily the Northeast and Upper Midwest, as indicated on the dot map that I showed earlier. And a little fun fact is I'm from Georgia, and I think I saw that only 10 cases were confirmed by the CDC in 2015, which is a lot lower than the areas where the map was showing. This is just another bar chart showing the increase in the confirmed cases, and the lighter shaded area is the probable cases. There's a two-step diagnosis process. The first step is an immunoassay test. This test is testing antibodies in the blood. If this test is positive or uncertain, there is a second test that needs to be performed. Depending on the length of time that symptoms have been present, the Western blot is performed independently or in conjunction with an additional test. If and only if both steps are positive, then a positive diagnosis of Lyme disease can be made. And this is a graphic showing the test. It shows the first test, and then it goes on. And if it is less than or equal to 30 days, then you use the Western blot along with the other test. And if it's greater than 30 days, you use only the Western blot. For treatment, currently the CDC only approves one treatment approach for Lyme disease. This treatment consists of a 7 to 10 day course of antibiotics. The recommended antibiotics are doxycycline, amoxicillin, or cefuroxime Extil. There's a small percentage of individuals that require a 3 to 4 week course of antibiotics. Patients treated early on usually recover quickly and fully. Other non-CDC recommended alternative treatments can be found, although the CDC strongly discourages alternative treatment. In a very small number of cases, symptoms remain after the long-term 3 to 4 week antibiotic treatment. This condition is labeled as post-treatment Lyme disease syndrome, or for short, PTLDS. Studies have been and continue to be performed on non-human subjects. These tests are finding that long-term antibiotic treatments does not provide any substantial improvement in symptoms. An interesting finding is that there were a higher number of the bacterium in the central nervous system than other tissues. Studies are being done and proposed to understand the relevancy of a host's immune system health. Hopefully, new treatments can be developed once the immune system factor can be fully understood. What that's saying is just that they think that people with better immune systems are able to resist Lyme disease than people with a weaker immune system. For prevention, as with most diseases, this is the best course of action. Individuals that plan to be outside should protect against tick bites. Such measures include application of insect repellent containing DEET. This DEET is harmful to ticks. Also wearing long sleeve shirts, a hat, and long pants with fitted legs, so that the ticks can't crawl in your pant leg. It is also recommended that when coming in from outside, a thorough inspection for the presence of ticks be done. And that concludes my presentation of Lyme disease, and thanks everybody for listening.